Welcome to the Deep Dive. Today, we're going to be looking at something I think you're going to find really interesting. Um, Acute Post-Streptococcal Glomerulonephritis, or APSGN.
Yeah,
Bit of a mouthful.
it is.
Basically, we're talking about what happens when a strep infection kind of goes rogue and starts messing with your kidneys. We're going to unpack those together and really understand what's going on.
Yeah.
Even if you're not a doctor, this is a really fascinating example of how our immune systems can sometimes overreact.
Yeah, for sure. It's a delicate balance between our body's defenses and then the potential for those defenses to backfire.
Right. Like our immune system is a bit of a frenemy sometimes.
Yeah.
So let's start by painting a clear picture. A patient comes in with some puffy ankles and a little bit of swelling in their face. Their parents mention that their urine looks a bit off color. A quick check reveals they also have high blood pressure.
Okay.
And the child just recovered from strep throat a couple of weeks ago. What would be your first thought?
Well, given those symptoms and the recent history of strep throat, APSGN would definitely be high on my list of possibilities.
Okay, so APSGN is on the radar.
Mm-hmm.
But before we get to the detective work of diagnosing it, let's break down what exactly it is and what's happening in the body.
Okay, so APSGN is an inflammatory condition that affects the kidneys, specifically those tiny filtering units called glomeruli. You can think of them like tiny sieves in your kidneys responsible for filtering out waste products from your blood.
So if those glomeruli are like sieves, what's clogging them up in APSGN?
It all starts with that strep infection. When your body fights off strep bacteria, it creates antibodies to target and destroy the invaders. But sometimes these antibodies can clump together with the strep bacteria and form what are called immune complexes.
And these clumps, these immune complexes, are what cause the trouble in the kidneys.
Precisely. These complexes can travel through the bloodstream and get stuck in the glomeruli, those tiny sieves. Their presence triggers an inflammatory response, basically an attack on the kidneys by the body's own immune system. And here's where it gets really interesting. The exact way this inflammation causes the classic APSGN symptoms is still being researched.
Oh, wow.
It's a bit of a medical mystery.
So we know these immune complexes are causing a ruckus in the kidneys. But scientists are still working out the specifics of how that leads to those problems.
Yes, we're still putting the pieces of the puzzle together. But we do know that the complement system, which is usually a helpful part of our immune defense, also plays a role in APSGN.
Okay.
It's almost like the body's reinforcements going a bit overboard, adding fuel to the fire.
So it's like a double whammy. These immune complexes causing trouble, and then the complement system, which is supposed to be a good guy, ends up making things worse. That makes sense, but how do doctors know for sure that someone has APSGN? Is it just those symptoms we talked about, or is there more to it?
The symptoms are definitely a starting point, especially that combination of swelling, high blood pressure, and changes in urination like blood in the urine, which can sometimes look brownish, or even like meat wash, as some medical texts describe it.
Okay, that's a pretty vivid image. I can see why they call it that.
Right. And then there's proteinuria, which means protein is leaking into the urine. That's another sign those kidneys aren't filtering properly.
So doctors are looking for those signs.
Yeah.
But you mentioned earlier that APSGN is specifically linked to certain types of strep infections.
That's right. It's not just any strep that can lead to this. The main culprits are group A strep bacteria, specifically type 12, which usually causes pharyngitis, better known as strep throat, and type 49, which is associated with impetigo, a skin infection.
That's interesting. Why are those specific strep types more likely to cause problems in the kidneys? Is there something different about them?
That's a question researchers are still exploring, but there are theories that these particular types might have certain components on their surface that are more prone to triggering this immune complex formation and setting off that inflammatory cascade.
Okay, so it might have to do with how those specific types of strep interact with our immune systems.
Mm,
That makes me think about something else. You mentioned the fact that while APSGN is more common in children, it can occur at any age.
right.
Why would kids be more prone to developing this condition?
There are a few thoughts on that. Firstly, children, especially those in the 5 to 15 age range, tend to have more exposure to strep infections. They're in close contact with other kids in school and daycare settings, which makes it easier for those germs to spread. Secondly, their immune systems are still developing and might be more likely to overreact to certain triggers like strep bacteria.
So more exposure in a developing immune system put kids at higher risk. But it's a good reminder that adults aren't completely off the hook.
Exactly. It's something to keep in mind, especially if you've recently had a strep infection and start noticing any of those telltale signs we talked about.
So we've got those initial symptoms and a recent strep infection as clues. What other tools do doctors use to pinpoint an APSGN diagnosis?
Blood tests play a crucial role. They can reveal a lot about what's going on inside the body.
Okay, let's dive into those blood tests. What exactly are they looking for?
One important finding is decreased levels of something called complement, specifically C3, which we talked about earlier. Remember, that's part of the immune system that can go a bit haywire in APSGN.
Right, those reinforcements that can end up causing more harm than good.
Exactly. And they might also check for elevated antibodies against strep bacteria using a test called the ASO titer. These antibodies are a sign that the body has recently been battling a strep infection, which, when combined with other findings, strengthens the suspicion of APSGN.
So the blood tests help confirm whether there's been a recent strep battle and if that complement system is out of whack. But is that always enough to make a definitive diagnosis of APSGN?
In most cases, yes, especially when combined with the patient's symptoms and history. But sometimes, especially if the case is severe or unusual, doctors might recommend a kidney biopsy.
A biopsy sounds a little intimidating. What exactly does that involve?
It's a procedure where a doctor takes a small sample of kidney tissue using a very fine needle. It might sound scary, but it's usually done with local anesthesia, and the discomfort is minimal.
So it's a way for doctors to get a firsthand look at what's happening in the kidneys.
Exactly. And the findings from a biopsy can provide valuable insights. They can see those telltale signs of APSGN under a microscope.
Like what kind of signs?
One of the classic findings is something called humps. These are deposits of those immune complexes, those antibody-antigen clumps we talked about earlier, that build up on the filtering membranes of the glomeruli.
So seeing those humps is a pretty clear indication that APSGN is at play.
It's a key piece of the puzzle. And they might also see a pattern called starry sky, which describes how the glomeruli look when stained with a special dye that highlights the complement proteins. It's a visual representation of that complement activation and the inflammation happening within the kidneys.
Humps and
Mhm.
starry sky. Those are pretty vivid descriptions for something related to kidney disease.
It is quite striking imagery, isn't it? It's a reminder that even within the complexities of medicine, there's a certain beauty and wonder in the way things work at a microscopic level.
Absolutely. So we've talked about those telltale signs and the diagnostic tools, but now let's shift gears and discuss treatment. What can people expect if they're diagnosed with APSGN? Is it a case of wait and see, or are there more active interventions?
Fortunately, there are effective ways to manage and treat APSGN.
Okay, let's dive into those treatment options. What are some of the approaches doctors typically take?
The first step is often addressing those uncomfortable symptoms and supporting the kidneys while the body heals. That might involve some classic lifestyle changes like rest and dietary modifications, particularly limiting salt intake, which can help manage fluid retention and reduce swelling.
So it's about giving the body the best chance to recover.
Exactly. And in some cases, doctors might prescribe medications like diuretics, which help the body get rid of excess fluid, and antihypertensives to control blood pressure if it's elevated.
Makes sense. But what about those pesky strep bacteria that kicked off this whole cascade in the first place?
Ah, yes. Addressing that initial trigger is crucial. Antibiotics are usually given to completely wipe out any remaining strep bacteria, making sure they're not contributing to the ongoing inflammation.
So it's a multi-pronged approach, managing the symptoms, supporting kidney function, and eliminating that initial trigger, the strep infection. What's the overall prognosis for someone with APSGN? Is it a condition people typically recover from fully, or are there long-term concerns?
The good news is the majority of people with APSGN, especially children, do recover fully. But it's not always a quick fix. It takes time for the kidneys to heal, and there are potential long-term considerations that are important to keep in mind.
That leads perfectly into our next segment. We'll delve deeper into those long-term considerations and what recovery from APSGN truly looks like after the initial storm has passed. Welcome back to the deep dive. We're continuing our exploration of APSGN, and we've already covered a lot of ground. Those sneaky strep bacteria, those overwhelmed glomeruli, and the detective work of getting a diagnosis. But there's a lot more to uncover, something that might surprise our listener, even someone who's already pretty familiar with APSGN.
One thing that really struck me was the global perspective. While APSGN might be less common in developed countries, it's still considered the most frequent glomerular disease in children worldwide.
Wow, that's a big statement. I think a lot of people, myself included, might assume that a condition like this is pretty rare.
Yeah, it's easy to fall into that trap, but the numbers tell a different story. And here's another interesting tidbit from the research. There's a significant gender difference. Boys are affected by APSGN twice as often as girls.
That's fascinating. What's the thinking behind that discrepancy? Is it something about how boys' immune systems respond to strep? Or maybe they're just more likely to get those infections in the first place?
That's a great question, and it's one that scientists are actively investigating. There are theories that hormonal differences might play a role, or perhaps boys' immune systems are simply wired to react a bit more aggressively to those strep bacteria.
Okay, so there's still some mystery surrounding those gender differences. It seems like there's always more to learn, which is what makes this so captivating.
Exactly, and the diagnostic process, particularly the use of kidney biopsies.
We touched on biopsies earlier, but I'm sure our listener would appreciate a deeper dive into when they're recommended and what kind of information they provide.
You're right, it's worth unpacking this a bit more. Specific situations where a biopsy can be particularly helpful. For example, if someone has severe symptoms like significantly reduced urine output lasting for more than 3 days, a biopsy might be warranted to get a better understanding of the extent of the kidney damage.
So in cases where those warning bells are really ringing, a biopsy can give doctors more information to make the best treatment decisions. What are some other red flags that might prompt a biopsy?
The research also mentions persistent symptoms. So, if high blood pressure or protein in the urine is sticking around for more than a couple of weeks despite treatment, a biopsy might help determine what's going on at a deeper level.
It's like having a behind-the-scenes pass to see exactly what's happening in those kidneys.
That's a great way to put it. Microscopic findings that doctors might see when examining that biopsy tissue. Remember those terms we discussed, humps and starry sky?
Yes, those descriptions really stuck with me. Can you remind us what those terms refer to and what they reveal about APSGN?
Absolutely. Humps are those telltale deposits of immune complexes, those antibody antigen clumps that accumulate on the filtering membranes of the glomeruli. They're a direct result of the immune system's response to that strep infection.
So those humps are like a fingerprint of the immune system's battle against those strep bacteria.
Exactly. And starry sky, that refers to the pattern you see when the biopsy tissue is stained with a special dye that highlights the complement proteins. Remember how we talked about the complement system getting overactivated in APSGN?
Yes, those immune system reinforcements that can sometimes cause more harm than good.
Exactly. So this staining technique reveals a pattern of bright fluorescent spots against a darker background, resembling a starry sky. It's a visual representation of that complement activation and inflammation happening within the kidneys.
It's fascinating how scientists can use those techniques to create those visual representations of what's going on at such a tiny scale.
It really speaks to the power of technology in helping us understand these complex biological processes. And speaking of understanding treatment and management,
Okay, let's talk treatment. We already outlined the general approach managing those symptoms, supporting the kidneys, and eliminating those pesky strep bacteria. Research add anything new to the conversation?
multifaceted approach, crucial role of antibiotics in treating APSGN, not just any antibiotics, but ones that specifically target those strep bacteria that triggered the condition in the first place.
That makes sense. It's about going after the root cause, not just the symptoms.
Exactly. The importance of those supportive measures we discussed earlier: rest, dietary changes, and medications to manage blood pressure and fluid balance. Combining those approaches can significantly improve outcomes.
So it's about giving the body the tools it needs to heal while simultaneously tackling that underlying infection.
Oh,
Does this research offer any insights into how long it typically takes to recover from APSGN?
the recovery timeline can vary depending on the severity of the initial attack and how quickly treatment is started. It's suggesting that most individuals, especially children, start showing significant improvement within a couple of weeks of starting treatment.
That's encouraging. It sounds like with prompt and appropriate care, the body can bounce back fairly quickly.
It is an incredible resilience of the kidneys. They have a remarkable capacity to repair themselves, especially when given the right support.
That's a powerful message. It's easy to feel overwhelmed by the complexities of a condition like APSGN, but ultimately, our bodies have an amazing ability to heal.
That's a great takeaway, and it's something we should all keep in mind, not just when dealing with APSGN, but with any health challenge.
Absolutely. But even though those kidneys are resilient, there's still the question of long-term implications.
Something we'll explore further in our next segment, where we'll discuss those long-term considerations and what recovery from APSGN truly looks like after the initial storm has passed.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
Welcome back to the Deep Dive. We're wrapping up our exploration of acute Post-Streptococcal Glomerulonephritis, or APSGN as we like to call it. We've journeyed through the immune system's battlefield, those hardworking glomeruli, and we've uncovered the secrets behind diagnosing this really complex condition. But our exploration isn't over yet.
Yeah, you're right. We've still got some uncharted territory to cover. Importance of the long game. What happens after that initial recovery from APSGN?
Okay, so let's talk about that long game. What does recovery actually look like for someone who's had APSGN? Is it a case of all clear back to normal, or are there things people need to be aware of down the road?
It's not quite as simple as an all clear. Importance of ongoing monitoring, even after someone feels better and those initial symptoms have subsided.
So it's not just about treating the immediate problem, but also about making sure those kidneys are truly back on track.
Exactly. Regular checkups with a doctor are really key. Those visits allow for ongoing monitoring of blood pressure, urine tests to check for any lingering signs of protein or blood, and assessments of how well those kidneys are filtering waste
So
products.
it's like a personalized follow-up plan, tailored to the individual and how their recovery is progressing.
That's a great way to put it. And one of the things is keeping a close eye on kidney function. There are specific blood tests that can give doctors a really clear picture of how well those kidneys are working, even if someone is feeling fine and doesn't have any obvious symptoms.
So those blood tests are like a window into the inner workings of the kidneys.
Precisely. They can help detect even subtle changes in kidney function that might not be noticeable otherwise.
Okay, so regular checkups and those blood tests are important. But are there any other long-term concerns people should be aware of? Especially those rare complications we touched on earlier.
Those potential complications. And while they are rare, it's important to be aware of them. People who've had APSGN might be more susceptible to future kidney problems, even years down the road.
That's definitely something to take seriously. So what can people do to minimize those risks and protect those precious kidneys in the long run?
It might sound simple, but following those initial treatment recommendations is a great place to start. Things like completing the full course of antibiotics and adhering to any dietary or lifestyle advice from their doctor can have a significant impact on long-term kidney health.
It seems like those seemingly small steps can actually make a big difference.
Absolutely. And beyond those initial steps, maintaining a healthy lifestyle overall is crucial. Things like a balanced diet, regular exercise, and staying hydrated are all good for your kidneys and your overall well-being.
So it's about making those healthy habits a part of your everyday life and touching on the emotional impact of a condition like APSGN.
Yeah, that's an aspect that often gets overlooked. It's not just a physical challenge, it can be emotionally taxing as well.
I can imagine. Facing a serious health condition can be really stressful and scary, and even after recovery, there might be lingering worries about those what-ifs. What advice would you give to someone who might be struggling with those emotional aspects of APSGN?
I think open communication with their doctor is paramount. Doctors are not just there to treat physical symptoms, they're also there to provide support and guidance in navigating those emotional challenges. Don't be afraid to ask questions, express concerns, and seek reassurance.
It's a good reminder that healthcare is about the whole person, not just their physical body.
I couldn't agree more. And connecting with others who've walked a similar path can also be incredibly valuable. Support groups, either in person or online, can provide a sense of community and shared understanding.
It's about knowing you're not alone in this journey.
Exactly. And that can make all the difference in coping with the emotional ups and downs that can come with a condition like this.
Well, we've covered a lot of ground in this deep dive into APSGN. We've explored the science, those sneaky symptoms, the diagnostic puzzle, and those crucial treatment options.
Hmm?
But perhaps the most important takeaway is that knowledge is power.
I wholeheartedly agree. Understanding this condition, recognizing the signs, and seeking prompt medical attention can have a huge impact on ensuring a positive outcome.
And as research continues to shed light on the intricacies of APSGN, there's hope for even better treatments and preventative measures down the road.
Absolutely. The more we learn, the better equipped we'll be to support those affected by this condition.
Well, on that note of optimism and a hopeful future, we'll wrap up this episode of The Deep Dive. Thanks for joining us on this exploration of APSGN. Keep learning, stay curious, and always advocate for your health and well-being. Until next time.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.